We're very pleased and very proud to be part of the One Southern Indiana partnership with Assured Partners and with each of you here today. This is something that is innovative, something that I know that our company leadership was very attracted to when we started getting involved in the initial discussions, with One Southern Indiana and Assured Partners. And we see it as a great opportunity, not only for the organizations involved, but for you as an individual producer. We hope that this will open the door for many opportunities for you to place dental coverage in an environment where if you tried to do it on your own, you might not have all of the benefits and perks that we're going to offer here through the One Southern Indiana partnership. I just wanted to start off for the next few minutes and just give you all a little bit of a background on Delta Dental. I know some of you I've recognized and spoken with some of you this morning already, and so you may be well familiar with Delta. Some of you may not. So I'm just going to give a real broad-based 30,000-foot overview of Delta as an organization and what we look like and what some of the things we have done would consist of down here in Southern Indiana. Our mission is very simple. It's to be the dental carrier, dental provider of choice in your chosen market here in the greater Louisville area. And backed by our core values, we really want to bring the message that we're not just a dental carrier, because there are so many correlations these days between dental coverage and overall health. It used to be back in the day that everything was siloed. You had your medical insurance, you had your dental insurance, you had your vision insurance, life, disability, and so forth, and they never really intertwined or intermixed with each other. Well, those days are gone because there are now over 120 different diseases, medical diseases, that your dentist can diagnose or detect just by sitting in the dentist chair. And so we're bringing a lot of that into the formation of our contracts, our standard contracts. A lot of those benefits that we've structured to help your individual members at One Southern Indiana are inherent in what you'll see here with our plan offerings. Nationwide, we cover over 73 million people, which if you take that on a percentage basis, it's more than 1 out of every 3 Americans has coverage through Delta Dental. 1 out of 3 Americans who has dental coverage, I should say, has it through Delta Dental. We're a nationwide national carrier with affiliates in every single state, every single market. Our networks are consistent throughout the United States. So whenever you hear me talk about one of our dental networks, it doesn't just apply to the greater Louisville area. It will apply to any employees that your members may have in any other state, any other city, any other area throughout the United States. We serve all 50 states. 80% of all licensed dentists in the United States, on average, are participating dentists with Delta Dental. So we have 8 out of 10 dentists throughout the whole country. Now, it's going to vary in various geographic regions. It's even much higher than that in greater Louisville. So if the majority of your business is here in the metropolitan Louisville area, you're going to see participation percentages that are even much higher than that, which will benefit not only you, but it'll benefit the groups, it'll benefit the individual members as well. And we bring a lot of savings to our groups, and those savings that we measure and that we report back to our groups result in keeping us being able to keep our premiums at a very affordable level. How do our networks work? I'm going to get into what they mean, and a lot of you I know have worked with Delta Dental. You're pretty familiar with how we're structured from a network perspective, but yes, we are the nation's largest provider of dental benefits. 1 out of 3 Americans who has dental coverage has it through Delta, but we really feel like we bring the best of both worlds because we have an affiliate in every state, because we really leave it up to each local affiliate to determine what the local allowable dental fee should be for our network dentists in each geographic region. So we have people regionally who make decisions on behalf of greater Louisville in terms of what we allow our dentists to charge, instead of guys in suits in New York City and a high-rise in Manhattan making those decisions for us. Everything is done on a localized basis because, let's face it, if you are seeing a dentist in Louisville, New Albany, Clarksville, Jeffersonville, et cetera, is going to be a lot different than seeing a dentist in Los Angeles, California, or in Boston, or in Seattle, Washington. The fees are going to be much different. A lot of the practice patterns are going to be much different. And so Delta brings all of those localized idiosyncrasies into our determinations in terms of the kinds of contracts that we require our participating dentists to have. And everything is, so all of our networks are locally developed. So these are the people who call on dentists in the greater Louisville area on behalf of Delta Dental are people who work, live, in the area, and that's their full-time job. And so regardless of where one Southern Indiana would have even one individual employee, we can still cover them regardless. So you don't ever have to be in a situation where you have to worry about, okay, well, my group, ABC company, that has 30 employees has 2 out-of-state salespeople, and they live in rural North Dakota. Well, no matter where they are, they can still be covered under the same plan and have access to the same networks, regardless of where they may be located. This is really a slide that I think really gives Delta, or that really I think points to the big advantage that Delta brings over our competitors. Hey, I stepped over that cord without tripping. I'm glad. If you look at the bottom graph, that's typically where most of our competitors are. Most carriers in the marketplace these days will have some type of PPO offering. Even a lot of TPAs that are administering dental will rent networks. Dental rental networks are pretty big these days. And so what happens is, as long as the employee or the family member stays within the network, they get the advantage of the discounted fees. They may even get a better benefit as far as the co-insurance is concerned. But once they step outside of that PPO network, then anything goes. There can be balanced billing if the dentist fee is above what the carrier allows. They don't have to adhere to processing policies, et cetera. So this part's good. The darker gray part, once they get outside the network with other carriers, is where a lot of employees and family members can end up paying more for their services. Here's what Delta brings to the table that really makes us unique. Yes, we have our PPO network with the deeply discounted fee schedule. And I'm going to give you some figures here in a minute in terms of what those average discounts look like in the greater Louisville area. But on top of our PPO, we also have what's called the Delta Dental Premier Network, which it consists of dentists who have agreed to more of a moderate fee discount. So it's not the deeply discounted level that the PPO dentists have agreed to, but they still agree to no balance billing. They handle all the paperwork on behalf of the patient. They also have to adhere to all of our processing policies. So what that means for Delta compared to our competitors is that dark gray area, the non-participating dentist portion of those bar graphs, is a lot less with Delta Dental. Now, in greater Louisville, 95% of all Delta Dental, of all dentists, licensed dentists, are in network. And I'm going to get into that here on this slide. 75% of all Delta Dental claims dollars in greater Louisville, which would include Jefferson County, Kentucky, Clark, Floyd, and Harrison counties in Indiana. 75% of every Delta claims dollar is going to a PPO dentist with the deepest discount. Okay, that's how strong. I don't think you all realize how fortunate you are to have such great dental networks here. And we want to be able to really allow you to capitalize on the use of those dental networks on behalf of your groups. Another 20% of all Delta Dental claims dollars are paid to premier dentists, okay, the more moderate level discount. So that gives us a total in-network penetration, and this is our own data, and this is Delta Dental claims dollars. 95% of every claim dollar with Delta Dental in the greater Louisville area is going in network, either PPO or premier. 75% to PPO, another 20% to premier. Well, you may ask, okay, well, what kind of fee discounts are you seeing? Well, for PPO, for the greater Louisville area, our PPO fee discounts, the most recent fee data analysis that our actuarial department did is showing that we're seeing an average PPO write-off of 33.8%. So if the dentist's normal fee is $100 and he or she participates in our PPO, that $100 immediately gets cut down to right around $63, $64. Okay, $67. With Premier, our average fee discount is 12.5%, and we've really held the line on fee allowance adjustments through the years. This figure for Premier used to be down around 3 or 4%. Now we're seeing, and this is Greater Louisville, we're seeing a 12.5% average discount for Premier. So that same $100 fee for PPO would get cut down to the mid-60s.